has touched my life in very painful ways, as I have come to know so many of the heroic people living with the disease, and they have become my friends. Just last month, I lost a close friend and fraternity brother, Neil Alexander, to ALS. Neil was an amazing man who patterned his life after Lou Gehrig. He vowed to live his life like Lou as long as he was alive. But at age 49, he suddenly struggled to breathe and lost his battle with ALS way too early, leaving behind a beautiful wife, an 11-year-old son, a 13-year-old daughter, not to mention extended family and friends. He has been here, standing with me, standing where I am today, just 2 years ago, to advocate for state funding, and he was proud and honored to do so. The very special people, the men and women I have come to know who have been struck down in the prime of their lives are no longer able to work. They will not be able to walk with their children down the aisle. They rely solely on those around them for the simplest of tasks. And worst of all, they lose their ability to say thank you and I love you to those who stand by their side. ALS is a progressive, fatal disease, and upon diagnosis, people face a slow paralysis of their muscles and eventually lose the ability to swallow, eat, speak, and breathe. The cause of ALS is still unknown, but studies show that our military veterans are twice as likely to develop and die from ALS. This is a service-related disease, and therefore it is the duty of the Pennsylvania legislature to support ALS patient care. As our state has the fourth largest population of military personnel and veterans in the country, we are here today to remind our legislature and the Pennsylvania taxpayers that a modest amount of funding for ALS that is currently in the state budget is not enough. The average cost of the disease to a person living with ALS can be $250,000 each year. Without the care, medical equipment, and support provided to patients and families through the ALS Association, the majority of patients would be unable to stay in their homes and would be forced to move into state-run institutions. The annual market value of free services provided by the ALS Association is close to an estimated $13.5 billion, with a B, billion dollars. Yet, state funding we receive is equal to only $388 per patient. The ALS multidisciplinary clinics throughout the Commonwealth help people with ALS live longer, healthier lives, and this also saves the Commonwealth of Pennsylvania as much as $92,000 per patient per year. The state cannot afford to not continue the line item funding for ALS patient care. We are asking not only for continued support, but a very reasonable increase from $350,000 to $500,000 per year to support ALS patients and their families throughout this Commonwealth. A small investment yields significant cost savings to the state, but better yet, it improves the lives of hundreds of ALS patients, including our military heroes who have put their lives on the line for all of us. Now please welcome Tony Howe, the Director of Communications and Public Policy for the ALS Association Greater Philadelphia Chapter.
Thank you, Chris, and thank you to our friends at the Western Pennsylvania chapter. Together we are united in support of all people with ALS. I came to the ALS Association 4 years ago, but ALS touched my life many years before. I started my journey with ALS when my grandfather was diagnosed in 2005, and he passed away just 2 short years later in 2007. But while my connection is family, everyone that works at the ALS Association, from volunteers to staff and caregivers, and now even to the people here in Harrisburg who are our legislators, this cause is very personal for many reasons. Like Chris said, military veterans are twice as likely to be diagnosed with ALS, and my grandfather, a service member in the Navy, was one of those. We watched him deteriorate, lose his ability to walk, lose his ability to use his hands, and eventually lose his ability to speak and breathe. But I remember mostly not how hard it was on him, but on how hard it was for the people that he loved and that loved him. I'll never forget how hard it was for my grandmother to not hear him say I love you, or to call her his girlfriend. And that's part of the reason that we're here today. While we're here for the 1,000 people living with ALS in Pennsylvania, we also care for the thousands of others who are attacked by this disease, whether they're wives or husbands, sons and daughters, grandchildren, friends and neighbors. Our services make a big difference for them. 7 years ago, when my grandfather lost his battle to ALS, many of the services that we talk about today didn't exist or hadn't grown to the level they are now. He didn't receive home care services like we can provide now. He didn't receive assistive technology, something we can do now. And his clinic experience, while good, was not at the same level it is today, and that's thanks to the people at both of our chapters. While I work at the Greater Philadelphia chapter, he and I are from Pittsburgh, and I'm glad to know that there's people all across this great state that are doing a lot. One thing, though, that is very important to me working at the ALS Association is knowing that I'm working with such passionate and dedicated caregivers. The funding that comes from the state and from your donations goes to make sure that we can provide excellent care. As Chris said, there are ALS Association certified treatment centers and many other services like our in-home care program, wheelchair loaner closet, speaking devices, and things that just make it easier to open doors and just live life a little bit easier so you can live in the convenience of your home so that your loved one is able to continue working and that you can continue living a life that you want. One of those caregivers is here today, actually many of our caregivers, and her name is Maureen Reed, a nurse at the Hershey Medical Center. Maureen came to us with a personal connection, and like our patients, she inspires me and many of our others every day. She works hard every single day, beyond her own clock hours, to make sure that people with ALS get the care they need, and though she cares for hundreds of people with ALS, none of them are a number. Each one is a person worthy of dignity and respect, and ultimately her love. Thank you, Maureen.
Good afternoon. Approximately 4 years ago, I took position as a staff nurse at the ALS Association at the Greater Philadelphia chapter. My role is to manage care of ALS patients and their families here in South Central Pennsylvania. The majority of these patients and families attend the National Recognized Certified ALS Clinic at Penn State Hershey Medical Center. This clinic is supported by the Greater Philadelphia chapter of the ALS Association. I was very familiar with the chapter and the multidisciplinary clinic because my late husband, Richard Kelly, died from ALS in 2003, leaving behind 3 children and myself. He was 47 years old. We were privileged to have the support and services of this ALS Association during his illness. Multidisciplinary ALS clinics have been studied, and results have shown they provide optimum health care delivery, prolong survival, and enhance the patient's quality of life. At Penn State Hershey ALS Clinic, I do believe that this is the case. Although we don't have a cure, our main goal is to provide effective symptom management, thereby optimizing the quality of life of the patients, their families, and caregivers. Our nationally recognized clinic consists of neurologists, nurses, social worker, physical, speech, and occupational therapist, a wonderful nutritionist, a respiratory therapist, our fabulous nurse counselor, and our much-needed spiritual counselor. Our patients are seen by these providers every 3 months in a centralized location. It is the education and guidance from our clinic team that empowers our patients to make informed choices, giving them an improved quality of life. The expertise of our national recognized multidisciplinary clinic at Penn State Hershey Medical Center is a unique setting that is convenient for our patients and families that are already struggling with the progression and devastation of this disease. These services have been referred to often as their lifeline by our patients and their families. As the disease progresses, the complex medical and emotional needs are addressed and supported by a multitude of services that couldn't exist without the support of the Greater Philadelphia chapter. For example, our Marjorie Shimmer Equipment Loan Program allows our patients to receive immediate access to medical equipment that isn't covered by their insurance, thereby saving them an additional out-of-pocket expenses. All I can say is, it is imperative to those battling this disease that these specialized clinics continue. Thank you.
Now I want to introduce my friend Dale Miller of Montgomery County, Pennsylvania, who, like my grandfather, is a veteran living with ALS, and living and thriving and working hard to defeat this disease. Thank you, Dale.
Thank you very much, Tony. I appreciate that. As Tony said, my name is Dale Miller, and ALS is my constant companion. But unlike my beautiful wife and all my friends, it's not a companionship that I really value. We don't have any fun. Like many veterans, even active duty people and reservists, I was always physically active, running, hiking, biking, and doing all those other activities that we all enjoy. But ALS took those activities away. My legs grow weaker every day, my hands are showing sign of weakness, and although I'm a slow progressor, the disease doesn't stop. It just varies its speed. I first noticed symptoms of the disease when I was on active duty with the Marine Corps in Djibouti, Africa in 2004, when I began to stumble and trip and fall. It took years to get a final diagnosis, but I've got it now. My body is sore every day, my muscles are shrinking, I get night tremors, fasciculations, many times I don't sleep at all. I wear a brace for my foot, but I still trip and sometimes fall. But I'm not going to give into it. The ALS Association has helped me through counseling, through their social work, through their lending library, let's say, get through this disease's progression. I still continue to work. I'm an attorney for the Commonwealth of Pennsylvania, and I'll continue to work until I just can't do it anymore. All I know is I'm one of many, many people that have ALS. We want to find a cure. We want to find a cause. And hopefully the money that we're begging for today from the legislatures will help us make life a little bit easier for all those persons like me who have this terrible disease. Thank you very much. Senator Greenleaf, I'm Dale Miller, retired Colonel in the United States Marine Corps, and I have ALS. And I'm here to present you with our ALS Advocacy Day Award. All your support, and I hope you continue to support us in the future because we need the money. Thank you, sir.
Let him speak.
Thank you very much. It's an honor to be here today and to talk about ALS. You know, we're in a society that we're making tremendous leaps and bounds in medical field, and this malady is no different. And so it's important, though, that we provide the funding, the government provide the funding to provide for the treatment, the care, and the cure of individuals with all the diseases that affect humankind. And this is one of them. And I've always been pleased to be an advocate for more money to help us to resolve these issues, to treat these people who have different diseases, and to care and hopefully cure them of what they suffer, and to prevent them from happening in the future. So it's my pleasure to be here today to advocate for you and for your loved ones, and to advocate for the end of this disease that takes so many of your loved ones and our loved ones. Thank you so much for your involvement too, and your dedication to educate people and to get them